back to the HealthLeaders Exchange Podcast. I am Abby here with the HealthLeaders Exchange team. We have an exciting fall coming up. We're rolling into our fall exchange season, if you will. So our CFO exchange is coming up. We have a completely full Chief Medical Officer exchange this year, which is very exciting. Similar for our revenue cycle technology, that's a full event as well. So exciting things coming from the healthcare space, particularly as we go into the fall. Lots of very dynamic discussions going on. And one that I would like to highlight is our workforce exchange, which we've done for 2 years now, really dedicated to the topic of workforce. So today, our entire podcast is dedicated to workforce challenges and solutions. And so we have an expert joining us. I'm going to let them introduce themselves and then we'll get started. Jacob?
Thank you. So I'm Jacob Laufer, the Chief Operating Officer here at ShiftMed, which is the Workforce Command Center for leading health systems. So we build the infrastructure that allows health systems to run their own flexible workforce programs, which is fully integrated back into their clinical ops. So whether they're on Epic, Cerner, UKG, Simpler, we connect everything together so that they can build out their own flexible workforce programs, as well as tap into our leading marketplace solution.
Thank you for joining us. And like I said, this is a big part of the conversations that we'll have for the rest of the fall, and I presume into 2026. That ever since the pandemic, and even before, the idea of the workforce is really a challenge. And I'll never forget, I was sitting in a CFO exchange. I think it's been 3 years ago now. It's right after the pandemic. And we had some things we were discussing, different topics, and workforce was going to be one of our topics. And one of our CFOs stopped the conversation completely. I don't even recall what we were discussing at the moment, but he stopped it completely and said, guys, I don't think you understand. We can figure out all of these other challenges that are coming up, but until we solve this workforce crisis, was the word that he used, none of it else, none of it matters. This is really a crisis at our hands. And I think it's slowly getting better as the years go on. It's maybe not a complete flip to the way things were, but I think it's getting better. But I think there are different shifts rather than just, we're hemorrhaging money on the workforce now. I think there's a little bit of nuance to the workforce challenge. So why don't you, being again this expert joining us today, set the stage for us as you see, now that we're officially post-pandemic, travelers have gone down a bit, so that's not necessarily top of mind for a lot of our systems. Why don't you kind of set the stage of where we're at for staffing in hospitals and health systems officially post-pandemic, as we're calling it?
Sure. Yeah. So, clearly, as you indicated, right, like most systems, I actually just did a feature this morning with Blake Madden on hospitology. So he was pulling into publicly traded health systems like HCA, Tenet, CHS, Ardent, right? If you go back to their pre-pandemic and during the pandemic baselines, right? Like somebody like a CHS was close to about 15% of all of their salaries, wages, and benefits was coming from contract labor.
Right.
And now post-pandemic, that's down to about 3%. Right. You've got some systems like Tenet that are actually going below their pre-pandemic baseline. So we're certainly seeing that. Now, quietly, I am seeing, though, premium pay, overtime, bonuses, incentives now quietly becoming some of the largest cost drivers across a lot of our systems. And that's really continuing to outpace, increases in average hourly wages, as well as we work with a number of systems that are in the process of moving, internal agencies were a really positive financial move to make when contract labor was 16, 17%.
Sure.
But now that it's 2 or 3%, those models are actually more expensive than a lot of their core FTEs and how that they can do it. So, that's been an amazing feat for health systems to recognize and see. And you have some leading thought leaders as well, like Mercer and other types of industry trade groups out there that really are saying from a nursing perspective that, we may not even be in a shortage except for some select areas across obviously rural area is still a large challenge, but for the most part, that there's going to be enough clinical nurses in a lot of areas by 2027. More dire needs across all the different allied areas, but what we've really been focusing on is that it's clear that we're not just dealing with staffing shortages. We're really seeing a more of a flexibility imperative. So like nurses and clinicians really want more control over how and when they work. And something that we think is like the most overlooked shift that's actually happened and was probably covered up by some of the pandemic chaos. But to give you a sense, if you go back to 2020, 43% of nurses were over the age of 55.
Yeah.
Now that is just 18%.
Right.
Gen Z didn't even exist. Now they make up 1 in 5 nurses.
Right.
And so we've really had just a generational shift happen of like how people want to schedule shifts to how they want to grow their careers. And for health systems now, instead of being managing maybe outdated vacancy processes of we have 100 open jobs and we need to fill these, the new normal for them is like, how do you manage 20 to 40,000 open shifts per month, right?
Right.
And so where we're helping is without any types of automation, none of that is just sustainable at all.
Definitely. And I really appreciate that you bring up, because at our CNO exchange this year, that was a huge topic of conversation, is this generational shift. And it was going to happen naturally, but it almost like happened overnight in a sense of like you saw it happening, but there were other things to deal with. So you couldn't really prepare for it. And then it flipped. And then now it's kind of presented this base of, well, this is where we're at now. So what are we going to do about it? So that kind of tees into my next question, which you did so perfectly. So with the nature of the new workforce, so I think it spans across 5 generations, and each generation wants something different. The Gen Zs want that flexibility, like you mentioned. They want to be able to easily figure out what their schedule is, book what their schedule is, be able to switch easily and things like that. Whereas the more seasoned nurses that are the more knowledgeable nurses that are a real asset to the health systems, they like the way things used to be, and they really flourish in an environment like that. And where the environment has to change, that creates a bit of a struggle. So with the new nature of the workforce and all of these things sort of in flux, really because it's just changing, right? Healthcare executives have had to become more flexible, which I think is sometimes easier said than done. I think we can all agree that the healthcare industry, while it does adapt and it adapts every single day, sometimes it's on the slower side to be able to quickly pivot to new strategies, technologies, and things like that. What are you seeing them keep top of mind as they work with their new generations, with new grads that are coming in, with seasoned nurses, that have been there for a long time? How are you seeing them work with the staff, develop on their own new strategies that'll propel them forward, and really taking a look at the industry as a whole and think, if we don't change X, Y, and Z, we're really going to put ourselves even more behind. So what are you seeing them keep it top of mind?
Yeah, I mean, I think that health systems are recognizing that flexibility is now foundational. It's no longer like a nice to have. And the old model, as you mentioned, was really all or nothing, right? It's either full-time, travel, leave of absences. Now execs are really asking, how do we build a menu option, like a menu of employment options for our clinical workforce, right? You're going to have people that just want to work 2 shifts a month, 5 shifts a month, want to work per diem. We're seeing massive growth in internal flow pools. Some partners having over 3,000 people inside of just their one clinical flow pools. And now looking at tools and technology to help them to manage them all from one system, right? Like, how do we create intelligent processes that can allow for the optimal cascade across all those different menu of options, right? And I think that's ending up in a really great place for both the hospital and for the caregivers, right? So from the
Mm.
hospital side, it's it's all about cost containment and operational control. And from the caregiver side, it's about autonomy and balance. Getting that right is like the secret sauce and the sweet spot that like both sides are being able to win. So we've seen just a large increase in that. I mean, our platform, our ShiftMed Flex platform, really helps you to enable this model. So it pairs with AI across any of their internal scheduling systems so that they can help to build out those menu of employment options and then route shifts to the right resources at the right time.
Oh, I love that. Let's keep on this flexible staffing planning. Because like I said, at the CNO exchange, it was also a big topic of conversation and making sure that, and I like what you said, flexibility kind of has to be the norm, right? It can't just be an option. Um, so when you look at larger workforce planning, again, it's not just trying to fix the here and now, but how do we make this a sustainable model? How does this become sustainable so we don't find ourselves like we were in the pandemic as much as we can, knowing things that are going to come up? How does that integrate this flexible staffing into workforce planning when you consider things like succession planning, burnout prevention? Those are two big key areas, particularly again, when we were at our CNO exchange. Those are two hot topics for our CNOs as they look at their directors and their managers. They want to dedicate time to succession planning, making sure they're not burnt out. But how does this flexible staffing kind of integrate into that larger plan? Because the way I see it, you can't have one without the other, right? You can't work on succession planning and burnout prevention unless you have sort of the staffing piece fixed out, so that you can turn your focus to other things. So how are you seeing that sort of play out in the health systems that you work with?
Yeah, I mean, I think that it has to be the core of what you're planning from. And, you can't have secession, you can't have burnout prevention if a lot has been shared at AONL as well as at multiple of your guys' events, that unit managers and even McKinsey just recently did a study on this, that unit managers are spending 65% of their time trying to fill shifts manually.
Right.
And we even just we actually are, this is a little bit of a sneak peek, but we are releasing our first annual float pool survey where we've surveyed hundreds of health systems to learn more about how they're doing it. And 67% of them are still manually trying to
Wow.
fill shifts. And even worse, like close to about 70% of them don't have any like self-scheduling technology to allow for them to
Wow.
even enable this, right? And so we've really helped to make ShiftMed Flex as the workforce command center so that it
Mm.
can automate all these different tasks so that it can route the shifts intelligently, it can match clinicians to the right units, manage these float pools, and then track credentialing in real time, right? That's often one of the things that I think is overlooked
Mm.
is like when systems want to think about, well, how do we have all these, maybe they came via acquisition. We have all these different hospitals in the same geography, but they all have different requirements.
Yeah.
And the change management to go through and standardize is just always pushed to the bottom. Well, we can actually enable where with our credentialing base to be able to know how to share clinicians in a proper basis, as well as show the clinicians from their profile where the delta is between maybe that they need to upload their latest ACLS to go
Mm.
work at a critical care unit across the street, right? So that we
Yeah.
can make these connections happen in real time. You also just need this so that you can build out that multi-layered PRN program and centralize the workforce planning, right? Still to this day, another learning from our flow pool survey is that only about 20% of organizations have centralized their actual workforce planning.
Mm.
And what that means, if you're not doing, means that you still have a ton of Excel sheets. You still have your unit managers just texting, to have your unit managers doing phone calls. And, that is not a place where if you don't break from that, that you're ever going to make, uh, big improvements in succession planning or burnout prevention. And we're actually seeing a lot of our partners now are having rounding competitions between facilities because we are just, automating every single one of these tasks and
Yeah.
areas. And so, and I think that that's just another thing where, AI can help to just really eliminate a lot of these just manual, siloed kind of processes. That's actually where I think it can be used the most. And I think from a clinician side, it will also help to really become like a career co-pilot. Like,
Mm,
if you're a CT tech, helping them to really be guided toward their next certification based upon demand. Or now, if you have this challenge that every health system is facing, is like we have, you know, 20 to 40,000 open shifts per month at a system. How do we show the 10 best shifts to that clinician for the goals that they want to achieve that week, right? And that's where
yeah.
I think that like everything is really heading. So we're not just really preventing burnout, we're actually helping clinicians work in ways that fit their lives better, which I think, you're hearing from OpenAI, Meta, Google, everybody else, talking about that, just helping it from an augmentation. And I think that that's going to be really great because it's going to give also from the health system side the visibility of the tools that they need so that they can plan the succession, scale these internal teams, and reduce any types of premium pay, whether that's contract labor, whether that's double, triple, quadruple bonuses that we often hear about
Yeah.
for certain select shifts, that they can just now better connect. And we're seeing that play out across a number of our early adopters, financial metrics, even so that they're now hitting, cost of labor benchmarks that, previously felt like they were unattainable. We have multiple partners that are 6 to 8% the below the median, which is right now about 48% for an average health system. And
Yeah.
we expect many of them to be in the mid to high 30s, and continuing to improve from there in the coming quarters.
I love looking at it from the perspective of, you know, the CT tech sees this shortage. Well, they see in this area, if they had, X, Y, and Z certification, that it could sort of elevate their career path. And just, it's almost that thing of visibility, right? You don't know what you don't know. So if you do things manually and you don't necessarily have access, and these employees and nurses and everyone in the health system doesn't have access to see what's actually out there for them, you almost have this blindness to it, right? Because you just know that you work this shift on this day and this is where they need you, but kind of seeing the whole scope, I think, is a
Well,
really good point of being
yeah,
able to sort of elevate your career as well.
yeah. There's a lot of we have been growing out open shift marketplaces for now close to about 7 years. I always tell people that I can measure our company by the age of my oldest daughter, who is now 6. So that means we've been doing this for about 7 years. And there's been lots of other early adopters of this type of mindset,
Yeah.
Starbucks being one of the most notable. So Starbucks has been building out an OpenShift marketplace for close to about 3.5 years. They've seen great success. The program was having about 10,000 open shifts be claimed on a weekly basis. So on an
Mm.
annualized, close to about 500,000 shifts of coverage, which you can just imagine what that would mean for a large entity like an HCA Healthcare if they could just have
Yeah.
more internal mobility. And Starbucks made the bold decision back in February to start piloting where they started to draw districts. So I live in the DC area, and baristas now across the greater DMV, which is DC, Maryland, and Virginia, can actually start to claim open shifts at all of the locations,
Okay.
right? And so what actually happened is on the first week of this going live, those 10,000 weekly open shift claims went to 20,000.
Oh, wow.
9,000 of the 10,000 incremental came from a barista working from outside of their home location, right? And that's the type of visibility, connectivity
Hmm.
that I feel like is solely missing from many health systems, not ours, but a lot of them that are still kind of set in these traditional mindsets of I hire PRNs to these units, I hire full-time employees to these units, I want them to work these 3 shifts a week. Like, you know, leaning out of that model, you can actually drive more engagement. And Starbucks, has publicly gone out and said that their retention metrics went through the roof, their cost went
Sure.
down. They have now taken this from small pilots in select geographies to putting out press releases that they're pushing it out to North America. They're trying to push it out to like every single Starbucks hub by the end of the year because they're having such a like mind shift change on this. And that's just one of like many examples that are out there of like, if people really lean into that kind of flexibility impairment, just some of the success that they can have.
Well, and to me, that's the kind of innovation that healthcare brings. And so I have not my last question, but something that you brought up. Of the 67% of hospitals and health systems that still manually work on filling their staffing, to you and the conversations that you have, what do you think the biggest barrier is for that 67% to move towards this automation?
Yeah, well, I think that a lot of that, the areas like what we're talking about, where you need to be able to tap into multiple different units at once, right?
Mm,
A lot of their legacy systems aren't built to be able to have that type of connectivity. So I think for the most part, they really just haven't had great tools and technology. I think that workforce technology has been, way overlooked for
yeah,
lots of probably decades now. I mean, the fact that a vendor management system is still a thing is pretty mind blowing inside of 2025.
yeah,
And so I think that you're starting to see a lot of that pick up. I think, you know, um, it's interesting just to see that so much focus has been, ascribed to the ambient AI solutions being able to
yeah,
help with burnout and different things like that. And, what's kind of interesting to see out of that is yes, like caregivers are having great satisfaction and great engagement and great, um, outcomes on their daily life, but then they really haven't seen any of the return on investments as far as like
sure.
implementing those types of solutions. And so I think one of the things that could potentially also, help to push this further along in a much more expedited fashion is some of the public policy changes that we're just seeing across the board. And because labor still to this day, despite anything that you're seeing on reduced amounts of contract labor and other, is still 56 to 60%
Sure.
of a health system cost. And so I think as we think about where we need to be more productive, that has to come to the forefront of priorities for leaders out there. And I think that there's probably no way better of creating burnout than making sure that people can actually have like a better work-life balance. And there's tools and technology that can help to now take all these different silos and push those together for the first time in a fully automated way, right?
Yeah.
Um, and and so I think that that's where we'll see great strides and making those succession, making those burnout. I mean, if you talk to unit managers, just they don't even have time to do rounding
No.
in any of these types of systems that you're still doing things manually, and that's where we're going to have better outcomes. That's where we're just going to have better engagement. It's just
Mhm.
and that's what they want to be doing.
Right.
Like
They don't want to be behind the
um,
computer making a schedule.
exactly. So we want to enable that, and I think it's it couldn't be more bullish or optimistic on the future of of health systems.
Yeah. So to wrap this up, I want to take a look forward. So if we fast forward to the next 5 years, and like you said, I think And I think it's everyone's goal to become more automated in scenarios like this, right? No one wants to be behind a
Yep.
computer manually making a schedule. No one wants to be doing these things. And so I think we are moving in that direction. So if we fast forward to the next 5 years, what do you think the workforce strategy, how do you think it will have shifted for like your quote average mid-sized health system? We'll take away academic medical centers, we'll take away rural. For an quote average mid-sized health system, what do you think that strategy is going to look like? Because again, in the next 5 years, a new generation will have entered the workforce again. So we'll
Yep.
have almost even more turnover in that sense. So what are you seeing?
Yeah, I think that you'll see a fully automated AI augmented workforce layer that is able to sit on top of any workforce management system and EHR platforms that is going to help systems to automate everything from open shift posting to optimizing their labor mix to routing shifts by cost, skill, and credential. Health systems are going to have humongous flow pools
Mm,
that they're also going to control their local labor marketplaces with technology, and they're going to have absolutely zero dependency on any types of third party contract labor. I think for caregivers, the future is going to be personalization. AI is going to help them to guide them through career progression. It's going to streamline all of their licensing and credentialing. It's going to remove any types of barriers for entry on allied roles that we
yeah.
like desperately need across this country. I often kind of think of it like what's happening in education. So many great strides there where, any kid out there is just going to get the most tailored learning path that
Yeah.
for us, we are, envious of. I mean, it's going to know exactly what your strengths and your weaknesses are, and it's going to make you just more well-rounded all around. And I think clinicians are going to get the same experience for their careers as a whole.
Definitely. And I think new generations have said the more flexibility, the more they can tailor their own experience, you know, that's what they want. And understandably, by the way, like none of this is obviously it's understandable. But I think tools like what you do at ShiftMed are only going to contribute to be able to move to that way. Because I think in the past they didn't have it. So you couldn't be quite as flexible, right? The resources just weren't there.
I would slightly probably argue a little bit with that. I think that the resources are there. You just need to unlock and uncover them, right? And that's where I think a lot of the mind shift will happen and is really starting to happen, right? As we think about care models, care teams being re-engineered, the augmentation of virtual nursing, I think is a great example of
Mm.
that, right? And I think that we're going to continue to um, see more and more of that direction.
Well, Jacob, thank you so much for joining us. ShiftMed is a fantastic partner of our exchanges, and we really appreciate you all joining us whenever you can to contribute to our conversations. And I know our executives appreciate it as well. So thank you for joining us on the podcast today to kick off a great topic for the rest of our fall.
Awesome. Thanks, Abby.